Welcome. My name is Patrick Toby at Equanimity Counseling and Consulting. Today we're going to play with some ways of working with pain, general pain or very specific pain. We're going to play with various methods, and you can notice what works best for you at an unconscious level. This process is designed to be an aid in your healing process and does not replace primary medical care. So let's begin. And the first thing is just to take a nice deep breath and let yourself relax with your exhale. Shift around a little, get more comfortable as you need to. There's no right or wrong way to do this. You can keep your eyes open, or you can close your eyes down. Whatever's appropriate for you. They may close and then they may open on their own. There's no right or wrong response. Like I said, there's no right or wrong way to do this. So just let yourself respond as you do. Just be where you are. Tune in to where you are. Or tune out. Or both. And you've been in these altered states before, as you lose yourself in music or a story, or that feeling you get as you sink down into sleep. Does your body feel heavier? Maybe lighter, like you're floating. Perhaps you forget your body entirely as you sink down deeper into sleep. Some people have previous experience in trance or meditation or guided imagery. I think we all have been lost in a daydream for a few moments at times, which is really all we're doing now, losing ourself. As we have a little daydream, and only you know how deeply you'll need to go, and you only need to go as deeply now as is appropriate for you to get the results that you want, to feel better, to feel more comfortable. I really don't know how much more comfortable you can feel or how deeply you need to go now. And I trust that something in you knows how deeply you need to go to feel better, to get relief, to get back to trusting the body, trusting your body's own healing abilities, and discovering inner health now. Somehow, someway, your body, your nerves, your muscles know how to create a better feeling. Because you've had times when you felt better. And it might have to do with relaxation, of letting go, having more blood flow to those areas. Your muscles, your tissues, your nerves. It could have to do with what we're talking about earlier, and tuning out of unnecessary signals, unnecessary sensations, if they don't serve any valuable signal purpose. So you have the ability to tune out, like your glasses frames on your face that you forget are there, like the noise of the TV in the background, or even the shoes on your feet that you quickly forget are there as soon as you put them on. Like any other thing you've gotten used to tune out what you don't need to pay attention to. You could find a letting go happening, an automatic, effortless letting go. And how do you go into trance? And what is trance? And how do you know that you're in a trance, or that you're going deeper? Sometimes for me, I lose track of where my hands are. I know intellectually they are there, but I don't really feel them anymore. Maybe there's a little tingling or numbness feeling in them. Maybe that's when I have a sense I'm going deeper. And it's different for everybody. For some people, it's that. The softening of muscles. For some people, it's different colors. Perhaps a different quality of thinking or attention. Or for some people, it is relaxation. A physical relaxation, a mental relaxation. For some people, it's a change in perception. And perhaps you've seen it already, experienced it already. Times when your muscles move on their own, like when your hand automatically moves to scratch an itch that you barely noticed, or all the actions you do to drive a car without even thinking about it, or even noticing what your hands and feet do to get you from where you are to where you want to be. For me, it starts with a feeling of pushing underneath one of the palms, almost like a ball of energy wanting to rise up and float. And so the goal, I think, is to trust your body and your non-conscious mind to do what it needs to do with the muscles, the little automatic movements or twitches. And it could be the thumb or the fingers that starts to move a little as you let go. A twitch or some other tiny movement letting you know you're unconscious, is listening to you and wants the best for you. As a way of your non-conscious mind, your unconscious mind, showing you that it can help you come up with ways to feel better, and maybe even working together to feel good, to get relief, to have a sustained period of comfort in the body, a sustained period of good feeling in the body. The muscles in the hands and the arms working together with the muscles in the chest and the neck and the back, all of it working for you, to cooperate with you and your intentions. Time again and again, you'll start to have old feelings disappear. So that if I saw you sometime in the future, you could tell me how much better you feel and what you think made the difference from this experience and other experiences you've had. How you felt so better, but I really don't know how much better. Time would have taught you that, would have shown you that. And there is that old saying, I was beside myself. I know that sometimes I work with people and have them be beside themselves, observing themselves in a certain way, perhaps seeing themselves so very comfortable and relaxed. Or another way would be to have the pain sit beside them, or maybe simply drain out of the body and down into the chair, into the floor, all the way down to the center of the earth, where the heat transforms it into wisdom and compassion. Somehow, some way, to leave it behind, to let it go. And one of the early uses of hypnosis before they discovered chemical methods, was for anesthesia. It's pretty amazing. They sometimes call this kind of hypnosis glove anesthesia, where it's as if you're wearing gloves filled with a cool anesthetic gel, and everything from the wrist down simply goes numb. And there could be these crucial nerve pathways that would have nothing to do with what chemical anesthesia might do, but could be applied very selectively, so that you could numb them out a little or a lot, so there would be a better overall feeling in the body. Trusting something in you to know exactly what you're listening for, so that you can feel better. Memories could be generalized and applied to good feelings in the body. Not just happy and pleasant memories or good times in your life. That could be helpful too. But to the good feelings in the body, the good muscle memories, pleasant muscle memories. When you felt good in your skin, alive in your skin, happy in your skin. And you can make arrangements with yourself at the very deepest levels to use anything that I've said that might have reminded you or evoked from you what you need to know or do, what you need to shift or change, or remember or forget, or remember to forget, or forget to remember. And that can carry on at another level while you're going about your daily life, your daily business. You're learning here. And only use the things that are right for you, and only in a way that's right for you. And tune out anything else that's not right, not helpful, that doesn't support you. And it's at your own rate and your own pace. Take a minute or two of clock time, and even if you don't think you've gone anywhere or done anything, that's okay. And just start to complete this particular trance experience in a way that's right for you, using as much internal subjective time as you need. And then when you're ready to come all the way out of trance, to open your eyes and reorient in a way that's comfortable and right for you, leaving behind in trance what's for your non-conscious mind to process, and bringing out what's for your conscious mind to process.